Thank you for joining us for today's webinar, Very Small Shop Fundraising in a Pandemic. My name is Zach Stambor. I'm a member of GG+A's marketing team, and I'm delighted to be joined by Al Novak, who is a GG+A Consulting Vice President and Vice President and Chief Development Officer at Excela Health, a not-for-profit health system that is the sole healthcare provider in Westmoreland County, Pennsylvania. There are few people with a better perspective on this topic than Al, who has more than 4 decades of experience in development and advancement across large and small institutions. Prior to joining Excela, Al held various roles at the University of Pittsburgh, including Vice Chancellor for Institutional Advancement and Associate Vice Chancellor for Corporate and Foundation Relations. Prior to that, he served as the Director of Corporate and Foundation Relations at Carnegie Mellon University. Before we get started, I wanted to briefly request that you take part in a brief survey at the conclusion of today's webinar that will help guide and inform our future presentations. With that, let's start today's discussion. Al, thank you for joining us today.
Hi, Zach. Hi, everyone. It's great to be with you.
So I'd like to begin by asking you to tell us a little bit about Excela Health, what you do, and how you operate in normal times.
Sure, Zach. August will be the beginning of my 4th year as the Chief Development Officer at Excela Health. This is my hometown hospital system. Our kids were born here and we received our care here. I serve on the leadership team of the system. We've got 2 small operating foundations with their own boards. As the title indicates, we are a very small shop. We have 1 other professional who actually worked with me at the University of Pittsburgh, and 1 very strong administrative assistant who also handles our database. We have 2 terrific office volunteers who were professionals. For scale for everybody, the last capital campaign this organization ran was a $10 million 3-year capital campaign, and it was conducted by the Latrobe Foundation. And again, for perspective, we're fortunate that the Latrobe community enjoys connections to the Arnold Palmer family, Mr. Rogers, the Pittsburgh Steelers, the Mellon family, and Scaife families. Historically, we've run a couple of golf outings, a black tie gala. We contact annual funds throughout the year. And in the background, we have we're building what I would call a major gifts program.
So that's what you were doing in normal times. We are certainly not in normal times now. So what was the immediate impact of the pandemic? And how and when did you realize that you needed to or should shift your approach?
Well, Zach, the immediate issue was our staff and our volunteers could no longer come into the office. We had to find a way to stay connected with each other and to make sure that the team felt engaged and emotionally connected with our work. The other immediate things is we had to postpone a major black tie gala that was only 10 days away, and a golf outing that was a little over 2 months away. There was a lot of fear. There was fear for our health. There was fear that we did not have enough PPE for our clinicians. And the senior team at the health system asked me to start procuring as much as I could through donations and via purchases with foundation resources. I mean, at one point early on, we were literally 2 days away from not having enough surgical gowns for our physicians, and we were talking about how do we adapt garbage bags to protect our frontline clinicians. I was actually working with local distilleries to convince them to produce hand sanitizers. It was actually overwhelming. You know, none of us wanted to end up where the city of New York was and where Italy was. And I had a very close friend in New York City who did come down with COVID, and he's in our business. And thankfully he survived, but boy, that all made it real. The other thing that we saw was that the costs of PPE just rose tenfold. 65 cents for a mask we were now paying $6. Surgical gowns, the cost increased 100-fold, and many products you just couldn't get. We also had to create 100 negative pressure rooms. Essentially, they were new isolation rooms in our system, and you had to outfit it. So clearly there was an immediate need, and you couldn't help but notice that you had to shift your priorities. So we to encourage the financial giving, we established the Pandemic Response Fund, and people immediately understood what that was all about. They also understood that the hospital had to remain open, and we had to save lives, and we had to keep people safe, our clinicians and our patients.
So could you just walk us through the process of how you identified partners? How did you evaluate who to work with? What type of time and resources did putting that in place require?
Okay. Well, like we always do, whether we're in a pandemic or not, Zach, in the business, we tend to look to our relationships first. Our partners, they became the stars of this show, the clinicians and the people in the community. Our job is often connecting the dots, connecting the relationships, saying, you've got to talk to this person, and I think you can help. We knew we had a compelling story, and we had, fortunately, a history of people and organizations who supported us. It was urgent. It was evolving. I started with understanding what we needed inside the system. I had to learn about the PPE. I didn't even know what PPE was until this all got started. But you start with those closest to you, our board chairs, and then one conversation led to the next conversation. We held Zoom meetings with each of our foundation boards to tell them what was going on and to keep them informed. We started to work with our aid societies. These aid societies are starting to disappear around the country for a lot of reasons, but ours are still here. We needed baby monitors to equip these 100 new negative pressure isolation rooms that we were establishing. I'm thinking, what do we need baby monitors for? Well, it was so the nursing teams can keep an eye on the COVID patients without always having to walk in. Because every time you walked in, you had to throw away the PPE you were wearing. There just wasn't enough. Well, these aid societies immediately went out to the community, and they secured 100 baby monitors. They were a mix of brand new and they were a mix of used, but they were showing up at our offices with these boxes of baby monitors. It was incredible. We got to the point where we were making our own gowns. As I mentioned earlier, we were days away with running out of them. It was the aid society, through their relationships, connections, and families that connected us with a furniture manufacturing firm in North Carolina. They sent us bolts of cloth and bolts of elastic. So we created a sewing machine. I'm pointing down across the street here. We actually set up a room with volunteers, many of them employees, family members of employees, who came in and were sewing masks and gowns right in the hospital. The Blind Association, one of my best friends is on that board. And he said, well, we sew material for the US military and that's all on hold. Maybe we can help. They ended up sewing gowns for us and cutting them out. It was incredible. Local universities, places where I've worked and had relationships, from teaching and volunteering, Seton Hill University, Pitt Greensburg, St. Vincent, they donated eyewear protection, they donated gloves, they donated shoes. I mean, they were closed, so they didn't need it in their own laboratories. My board chair runs a grocery store. He understands how to procure. I was getting 5-6 emails from him a day pointing out where I could go buy masks and so on. So it took a lot of time. It was fast. It was furious. But you start with your relationships and you go from there.
Now, you said it was fast. How fast was it? How long did it take you to put the program into place?
Um, I wouldn't say we actually had a program until we were 3 or 4 weeks into it. Up until that point, it was just, oh, go here, oh, go there, call that person, do that. And once you saw the patterns, then you say, okay, here's how we manage this. And once you saw the pattern, you saw a way to pull in your staff who were homebound into the process. And you know, we were all trying to figure out telework. We're all doing that right now. You know, I always hear Zoom meetings are exhausting from different people, but it's the best way we have to communicate right now. We were also trying to figure out a way to track all these donations, these gift in kind, the PPE, without our staff being here, and we figured that out. It took a little bit of time. We started from using simple Excel spreadsheets to the point where we worked with actually somebody from marketing who actually knew how to use Razor's Edge, and we pulled her in, and that way we were able to get things right into our database and make sure the stewardship letters were flowing.
So bringing all these different pieces together is like spinning plates. It's a real balancing act.
Right.
So like, how did you decide and determine who is going to fulfill each of these tasks? Fulfilling the balancing the need for gifts of PPE, the need for cash to pay for the PPE, managing the donations of food for clinicians, and so on and so forth.
Well, again, here's where we needed to pull in the internal partners, because you're right, it was a balancing act, and our time was just being chewed up. I mean, on top of the seeking of the PPE and philanthropy, you know, I was still involved in the hospital senior meetings. We were meeting twice a day for an hour, and we were doing that 7 days a week. The meetings got cut down to 1 day, and then we finally just ended them literally 10 days ago. So time was being chewed up. My office also became the drop-off point for much of our PPE. We did not want people walking into the hospital for their own protection and for our protection. But the internal partners really helped us get through this. Our marketing department, shout out for all the marketing folks out there. They were crucial. We used them to get the word out about what our needs were. They used social media. Social media was crucial. And we were constantly able to update what we needed. Marketing coordinated the donation of food for me. So if somebody called and said, hey, I want to donate food for the intensive care unit or for the emergency department, I was able to connect them with somebody from the marketing department who took it the rest of the way. I could never have gotten it done without those internal partners. The major gifts happened in the background of all this because I was able to push some of these things out to our internal colleagues. They happened because we've had relationships with them, and I had relationships with them. The local philanthropists really wanted to step up, and they wanted to help. So, you know, I was calling them, and they wanted to know what was going on. I was letting them know what was going on. And fortunately, they didn't want a 10-page proposal, you know, with a budget attached and, you know, and a cover page and all the things that we're used to doing normally. Give me a page. What do you need the money for? How can you keep your patients safe? How can you keep your caregivers safe? And they responded.
I That's just a quick mechanics question there. And like, how often do you reach out to these major gift prospects, and in what ways?
Well, this was phone. It was phone. You know, it was initial phone conversations and emails, or emails saying, "Can I give you a call?" You know, those folks. There were a number of larger foundations that helped us, and I knew the program staff from my time at Pitt and Carnegie Mellon going way back. You had to reach them at home, and thankfully they were right there to take the call or to set up a time to take the call. But you know, in our business, you've got to constantly communicate with your donors. The old, now we know it's true because we can measure things. But when I got started 35 years ago, we always talked about a rule of thumb. Well, the rule of thumb was you needed to reach out and communicate with your current donors because they were your best prospects going forward. And in this world, that remains true. So I would communicate as often as I had the time to communicate. And we were regularly, and marketing and my teammates were helping with this. We were putting something together we called COVID updates. That was going out weekly via email. We let them know how many people were being tested, how many were positive, how many was in the hospital, how many, you know, what their symptoms were. And that communication was happening via email weekly.
Well, that's a really good point. Having that regular touch point is a means of just keeping the dialogue going.
And even in a small shop, we can do that.
So I want to talk about the back end of things. So how do you keep the gears turning while also ensuring you're stewarding donors and maintaining the other key functions that just ensure everything works?
Well, one of the challenges we had with working from home and being in a small shop is, you know, our technology was not that strong, and we have a small, I mean, we don't have an IT department in our division. We have one in the health system. So we had to, it took us a little bit of time to get my colleagues who were working from home up and running with the data system. But once we got that going, we were able to keep rolling. They ran with the stewardship letters. We made sure that everyone who donated a mask or donated a gown or shoes or water or food, whatever, that they were getting a stewardship letter from us. Or, you know, the many cash donations. We kept that going, and remote technology allowed us to do that. And our AA would come in once a week. God, at the time's just flying here. Once a week, she would come in and make sure those letters got printed and out. And we made sure that she was in there by herself so she could mask, and she was not going to be anywhere near anybody else who could potentially make her sick. And again, we use marketing to help us with some of the processes behind the scenes. So they were terrific partners.
So what results have you seen or generated from this tremendous effort?
Well, first off, we didn't run out of PPE. So to me, that was the most important result. We managed to keep our docs and nurses and colleagues safe. So that was huge. We received just over 600 gifts during this time frame, which for us was remarkable. And many of these folks were first-time donors. There were a lot of people in the community that you know, they knew we were here and this was their hospital, but from a philanthropic side, I think they thought somebody else was taking care of us. So that's going to present an opportunity for us going forward to engage more people in an ongoing basis from philanthropy. We also, as I mentioned earlier, we did cancel one golf outing and one gala. I do believe that a small shop needs to have some sort of public event, but I'm not a big events person and I don't like to see lots of these. So this is going to give us an opportunity to rethink and naturally possibly bring a couple of these things to an end and allow us to focus more on major gifts.
So knowing what you know now, what do you wish you had known in March?
Well, from a medical side, we would have not done some of the things that we did in the health system. And of course, a lot of the things we had to do because government ordered us to do it. But what we've learned is that we can keep people safe. I don't know, sorry about that. I don't know if you can hear the ambulance. We've learned that we can keep people safe with the PPE. So there are a lot of things that we can push forward with. From the philanthropy side, I wish that I was more adept at using social media. You know, I always had somebody to do that for me. In a small shop, I was lucky the marketing department picked it up for us, but I would have liked to have been a little bit more adept so I could see how people were reviewing it, looking at it, and maybe I can just use it as a tool a little bit more effectively. I was also reminded about how many people really do care about the hospital system that I did not know before. And, you know, going back to the social media side, and it was actually one of the outcomes, we did have one grateful patient who called me. Carol was her name, and she said, I and my husband both have COVID. I had a minor case. My husband is in your ICU. And I mean, she was in tears. She said, he's going to be okay, but I'm just so grateful, and that was her word, to people who putting their lives at risk to go in and take care of him, and I want to do something for him. And she said, I was thinking about a remote event, or virtual event, and we talked a couple more times, and in the end, she did a GoFundMe campaign, and she raised over $11,000. You know, and she was from a small community and incredible person. And it was such a privilege to be there when her husband was finally wheeled out of our hospital. He got a huge standing ovation. It was emotional. And it reminds me of why I'm here.
That's a really remarkable story. So I want to shift just a bit to zoom out, and given your experience at Carnegie Mellon at the University of Pittsburgh, what are some of the benefits or advantages in being a smaller shop that you don't have when you're part of a large institution?
Well, here it's only me. So as long as I fully understood what we needed, I could act. The other advantage is that I get to be closer to my donors in this role. You know, at Pitt, I was the vice chancellor, so there were layers of people, and I did get to work there with, you know, our principal gift donors and many of our major donors, but it's just different here. I'm far closer to it. I met a 93-year-old woman. She called me, and then I ended up meeting her. She wanted to help with this pandemic, and she got her sewing machine out, and she said, I'm going to sew masks. And she called me a couple days ago to see if we still needed them, and she said, I'm just glad I could help. That's wonderful. So that's one of the advantages of a small shop. I mean, I got to see the eyes of our physicians and our nurses when they saw just how much the community cared about what they were doing. You know, one of the things that I brought with me from the larger institutions, and it was from, you know, working with Grenzenbach and Gleer over all those years, is remember the major gifts. Yes, we received so many gifts of PPE and food and so on, but the fundraising totals were really driven by the major gifts that we got from the bigger philanthropists. So you can't ever forget that.
What are some of the challenges in not having the resources of a Carnegie Mellon or University of Pittsburgh?
Well, as I briefly mentioned earlier, it took us a while to get our technology up and running. I mean, Carnegie Mellon was known as Computer U, so I mean, the technology was ridiculous there. And you know, the big challenge is you don't have the human or financial resources of a larger institution, and also our donor pools, our prospect pools are smaller. There's no doubt about that. They're just smaller.
Sorry, I was on mute.
That's okay.
Start wrapping up by asking where you see things headed, both for Excela and smaller shops, as well as philanthropy at large.
Well, I think you start with philanthropy. The fundamentals of philanthropy hold true, whether you're in a pandemic or not, whether you're in a big shop or a small shop. I mean, I remember in 2009 being told by Martin Grenzenbach, when we had just raised our campaign goal at Carnegie or at Pitt to $2 billion, he told me that donors will want to support us even in a downturn. It may be a little slower, but our mission is important to them. If you're an important institution outside of a pandemic or outside of a recession, you are in it. So going forward, I think philanthropy will come back. It always does. It really didn't go away. The philanthropic spirit and the principles of philanthropy were here. It's just different right now. In my case, I was seeing, instead of cash gifts, I was seeing in-kind gifts. I've never been involved with so many gifts in kind. But the very fundamentals that we work with all the time, building relationships, telling your compelling story, remembering your best donors, inviting participation in what you're doing, that doesn't go away. And I also think there's so many social issues that we're dealing with now in our country. Philanthropy, people believe philanthropy can help make a difference and address these issues and can help us build a better, stronger community. We need our nonprofits to do that. We need higher education to do that. We need our hospital systems to do that. So I'm fully confident that, I mean, historically we've seen it. As the economy gets better, people feel more confident philanthropy is there.
Great. Well, I think that's a great note to end on. Thank you so much, Al. This has been extremely helpful and informative. As smaller and larger shops think about and implement changes on the fly in the midst of all this turmoil that's going on. So for those of you looking for more information about how institutions are adjusting to the new normal, please check out the Pivot Forward section of our website, friendsofocblue.com. Or feel free to reach out to Al or any of our other consultants. Once again, I'd like to request that you please take part in a brief survey that appears in the chat. With that, I'd like to thank you very much for joining us today, and thank you again, Al.
It was a pleasure. Thanks, Zach. Thank you, everybody. Good luck.